Okay, start broadcast. Start recording. Vitamins. They're good for you, right? Everybody takes vitamins. We think they're good vitamins. And let me tell you, there's a lot of research to suggest that vitamins are good for us. So, total. You know, Wheaties with all those extra 100% of the daily recommended dose of vitamins. Isn't that good? You know, one a day. Centrum Silver. You know, old people on bicycles, you know, because I'm taking my Centrum Silver and all that stuff. Research suggests in thousands, literally thousands of scientific articles that people who eat foods that have high amounts of different vitamins, you've heard of the antioxidant vitamins, right? That they do better. They have less heart attacks. They have less strokes. They have less cancer. There are studies where if you measure your bloodstream, if you have more vitamin C and vitamin A and vitamin E in your bloodstream, you have less heart attacks and strokes and cancer and lung cancer and all kinds of things. So naturally, we take extra vitamins. And in fact, I recommend extra vitamins to you. But there's this whole line of very troubling studies that suggest that taking extra vitamins as tablets doesn't help much. And so that doesn't make sense, and I want to talk to you a little bit to see if I can explain it to you and then give you some advice for the rest of your life, whether you have the surgery or not. So even the support people here this morning, this is good advice for all of us, given the latest research. So let's look at just a couple of recent articles. Okay, there's lots of research on vitamin A. Vitamin A is found as beta-carotene in green leafy vegetables and carrots. That's one of our former patients.
At least it's not the LDR or something.
Right. Okay, so I'll cut that part out. Let me try again. So vitamin A is found in green leafy vegetables, and lots of studies show green leafy vegetables are great for you. And in fact, that vitamin A in particular is good for you. Okay? Well, smokers get lung cancer. Smokers, when they study them, have a different risk of getting lung cancer, whether or not they eat green leafy vegetables, and whether or not they get vitamin A in their diet, and whether or not they have vitamin A in their bloodstream. So the Veterans Administration, you know, the huge healthcare system in the United States, said, we got tons of smokers. The vets are all smoking, and lots of lung cancer in the Veterans Administration hospitals. They studied 30,000 veterans, and they gave them vitamin A because of this research suggesting that vitamin A protect lung cancer. And wouldn't it be great if we could protect our veterans who are still smoking, can't quit smoking, or if they smoked in the past? Wouldn't it be wonderful if we could give them some vitamin A as a tablet and protect them against cancer? Well, there are studies of vitamin C, vitamin E, vitamin A, and folate showed no evidence that any of those vitamins protected against lung cancer. There's actually been some studies where they gave supplemental vitamin A and it actually increased the risk. Okay. Now with those backgrounds, and there's several other studies like that, as of February 1, the New England Journal publishes a summary, an abstract of some of the latest developments. So this is very troubling, and a lot of us have kind of, maybe that study was wrong. You know, not every study is perfect, and so, and there are several studies like that. Well, maybe they're doing it wrong, or that's the wrong vitamin A, or it should be given as beta-carotene, or there must be something about it. So in the same line, a lot of studies have shown that in men, high levels of vitamin C in your diet, high levels of vitamin C in your blood, of vitamin E in your diet, or vitamin E in your blood, or selenium in your dietary choices, or selenium in your blood, protects against prostate cancer. And that's important to at least 4 or 5 of us here this morning, right? All right, so the researchers, again, think of the size of this study, took 35,000 men. Can you imagine just keeping track of all the data, how much that must have cost the United States if we funded that study? And they took people who had underage or over age 50, no history or current evidence of prostate cancer, and they got randomized to either getting selenium, 200 micrograms a day, vitamin E, 400 units a day, both, or the placebo, didn't get any. They watched 35,000 people for 5 years. There were 1,700 prostate cancers, so lots to study, and there was no difference amongst any of them for any of those medicines. Vitamins did not help at all. Taking extra vitamins didn't help protect against prostate cancer. Another study of 14,000 doctors. They tried vitamin C, vitamin E, both vitamin C and vitamin E, and a follow-up of 8 years, 2,000 men got cancer, prostate cancer, 1,600 died, no difference. Okay, one more study, and then let's see how we can interpret that. All right, we do have some women here this morning, so in honor of you, there was an antioxidant, vitamins, and cancer prevention in women study. It's called the Women's Antioxidant Cardiovascular Study, abbreviated WACS or WACS. 8,000 women. They had cardiac risk factors, and they got randomized to either get vitamin C, vitamin E, maybe the vitamin E beta-carotene, or combinations, or a placebo. 9 years of treatment. So 9 years ago they started doing this study, right? No difference in heart attack or stroke. And no difference in any kinds of cancer. Okay, so how can we explain that? Well, I think it explains it by saying that the vitamins themselves are not protective, but the healthy foods they're in may be. So what we would like, I think, in America is to be able to eat Twinkies and pizza and cookies and then take a vitamin and still be healthy. And I think so far, we can't do that. Remember the advice, and we talked about this yesterday, is eat a healthy diet. That's what we're thinking is the bottom line. Fresh fruits and vegetables, whole wheat foods, that's our best advice to you and to people even who don't have the mini-gastric bypass. The vitamins themselves may be just a red flag that says where the good stuff is. There may be more little chemicals and things that are in green leafy vegetables, or oranges or lemons or things like that, or bananas or blueberries that we're missing when we take our one-a-day vitamin. Now, it doesn't mean that we can have a low vitamin C in our bloodstream. It doesn't mean we can have a low iron or something like that. But the foundation of our advice to you, and this research, which I think goes counter to probably what most of you believed as short as a couple days ago, until we started talking about it, says that vitamins are good for us, but taking a tablet is not equal to having a green salad. And taking a one a day is not equal to having blueberries and bananas or something healthy. Does that sound reasonable? Surprised? No? Okay.
Mom tells me that every day.
She tells
She's
me?
90.
Is that right? Okay. Well, I have been very surprised.